Hi, this is Trey Kwan. I'm a frontline nurse here in New York City with Left Voice. We're here to support an action that's organized by healthcare workers in the Bronx at Jacobi Medical Center. We're standing in front of the emergency room. This is one of the sites of a major crisis unfolding during this pandemic. Nurses and other healthcare workers and community supporters are here to denounce the inadequate personal protective equipment such as N95 masks and even supplies that are dwindling, as nurses are saying, and they are dealing already with a chronic shortage of safe staffing. These nurses have been fighting for years for safe staffing ratios, making that demand to New York City. However, those demands have never really been met. And in the middle of this crisis, they're feeling that shortage all the more brutally.
We're here today to have a moment of solidarity with our healthcare workers here. We want to have a message to the general public that we need more supplies, we need more PPE, we need more ventilators, we need more IV pumps. We know that this pandemic is here. So many of our hospitals are already struggling, and we need to make sure that we get the supplies that we need to do our job effectively and to do it safely. Our biggest concern right now is patient safety and our own staff safety. I'm sure you've seen everywhere the PPE that other countries are using compared to the PPE that we're using is very different, and we feel like we're being left behind. And so this is really a push on the federal government for the supplies and the resources that we need and that we know that they're able to provide, and we haven't seen yet.
Yeah. So we decided to wear bandanas today to show it's crap. Bandanas aren't protection. They're not protection. We need masks. We need proper surgical masks. We need N95 masks. We need our gowns. We need paper scrubs. We don't want to bring this stuff home to our families. It's not fair. It's not fair to bring it out into the communities after spending all night trying to cure people from it, to protect them, help people breathe all night. We should be able to breathe too. Nurses are getting sick, doctors are getting sick. We need support. We need ventilators. We don't want to make these awful decisions that we are forced to make in healthcare when we're limited with supplies.
And I'd like to send a message out there to the governors, to the presidents, to all those in authority, that your healthcare system is dying out, not because of lack of interest, because we do love our job, but because our nurses, doctors, and personnel are dying from this sickness. How would you like to be in our position? How would you like your family member to be in a position where they go out and only to get a call later on that they're ill? Then not only that, they're bringing the disease home to their relatives, to the rest of the family. This is insane. So please do something. This is a cry to you, Mr. Governor, to you, Mr. President, to all those in authority. It's a cry from the healthcare community.
We just ask that we need more supplies, to have Governor Cuomo tell us that nobody, no healthcare physician, nurse, worker should be saying we don't have access to supplies. Well, you said that a couple days ago, and I got told that yesterday. So just a little confused on what they're doing to help us, and what they're saying versus what actually is happening is just not true.
Exposure, every infection, every sickness, every death of a healthcare worker is 100% preventable. And the fact that healthcare workers are dying, that healthcare workers are getting intubated, that healthcare workers are getting exposed is a crime. And so we are out here to demand action by the federal government to get us N95 masks right now.